We went through all of those. There's many things. Therapeutic exercises, as we went through for the rehabilitation. For the ones who came in later, we talked about rehab. The main goals of rehab is basically give them some quality of function, to maintain some quality of mobilization, to maintain some feeling of independence, to give them range so they don't have contractures. Contractures in a patient laying in a bed, can't move. If a family member once a day gives a full range of the muscle every day, once a day, can prevent contractures. Once a day, if they will give the full range of motion. You can, if the patient is paralyzed or is possibly maybe get back some mobility in the legs, to prevent some dorsiflexion problems and everything, they wear a high-top sneaker in bed. You have them put on a high-top sneaker, and that will prevent a lot of stuff. Small things that could give them some quality later on. And especially if they've developed contractures of the shoulders, then you can't open them, and the skin start under the arms, the skin will start to break down. You can't clean the area. So contractures are a big complications, especially in an immobilized patient in a bed. The other things that we can also use, and we depend a lot on, is psychological interventions to help the patient deal with the issues, their denial of their issue, their anxieties, their jealousies. So those are just as important and play a big role, not only on our pain management, in the psychosocial of the patient itself. If you can't address these issues, no matter what you do for the patient, no matter you give the correct medications, no matter whether you give the correct interventions, it won't help. You also have to address this issue as well. And this plays a bigger, I think, in some patients more than people would like to admit to. Well, thank you. If you have any questions.
One question.
Yes.
There was a block that you talked about, and one of the indications were for the pain that came consequent to a liver biopsy.
Intercostal.
Okay. Is that block ever helpful? We have a young woman that we're working with who keeps getting
shooting pains?
No, lumbar punctures. She has a leukemia, so they keep taking fluid out, I think, to check for something or another. And she seems to be getting pain consequent to that, and the more she has, it keeps staying there. Is that ever helpful for that kind of a pain consequent to a lumbar puncture?
It can.
Interesting to think about.
Yeah, but the thing is, you have to also look at her labs. Is her blood, if she's got leukemia, how are the platelets?
She's not good on those numbers. I mean,
if it's below 50,000, then she can spontaneously bleed with any kind of intervention. Usually 50,000 is my cutoff in safely doing an intervention on somebody.
Even for lumbar puncture, we had to transfuse her, and then she got the lumbar puncture. So I don't think.
You could maybe think about a TENS unit. A TENS unit might be a better option if her labs are not as stable. A TENS unit might be not a bad idea. And also a lidoderm patch.
Thank you.
Both or either. Anything else?
That's great.
Okay. Thank you.